Hi, I'm Dr. Karaaltin from Karaaltin Clinic. We have a lot of frequent questions about the conception of how am I going to be after the BBL procedure and the body contouring in general, in a holistic way. Well, in the majority of our patients, they actually send us pictures of different models and they say that we want to be like this picture. Of course, this is a very nice dream. I totally respect it, and I wish that we would be able to do that, but that's not possible, to be honest, because every patient is unique. And I want to explain a little bit of some scientific facts that would try to reveal the fact behind it, and basically what are things that we can change and what are things that we cannot change, and then why that every patient is unique, and that everybody has to be the best version of himself rather than giving another example and aiming to be someone else, because this might not be possible. Now, one of the basic reasons in a body contouring procedure that defines the body shape is the bone framework. Yeah, so now let's talk about a little bit about the factor that defines the body contour. It's the bone frame. So if in particular, specifically, if we're going to talk about the buttock area, we know that the buttock frame is composed of 3 bones. We have the pelvic bone, it's like a wing here. We have the tailbone, which is called the sacral bone, and the coccyx. And we have the femur, which are the extremity bones or the leg bones here. So all these junctions create the framework of the buttock area. And actually, it would create the continuity of the lower extremity and the relationship of the lower extremity with the torso. So all are combined with one. And basically, this defines the body shape in total. So in certain patients, the bone might be narrow, might be widened, might be stretched out, might be tilted, might be inverted. The relationship with the pelvic bone and the femur bone here, as you can see, might be different. It might be angulated, it might be twisted inwardly, outwardly, and finally, the tailbone might be tilted. It might be tilted to the front, it might be tilted to the back. So all of these variables can define the bone framework of the patient or the person. So basically, this is a very important definitive factor that we have to base all our procedures regarding body contouring, and we have to rely on this stable factor because we can't change the bone. That is the unfortunate news. We only can create some illusion that can, convert the body type into something else that would be more pleasant and create a better version of the particular person or patient that's requiring to have the change. The majority of the patients that request the changing would be in the buttock area as well as in the torso and the upper part of the extremity of the legs or the thighs, specifically in female patients. So basically what we have to do first to analyze, explain the patient, the body type that they have or she has, and the tilt. The tilt is very important. Every race has a different specific angulations and proportions. And now, because we're very well experienced as a clinic and we have hundreds of patients from all around the world, I can tell you that we now know that every race has a specific, unique body composition of a bone framework. And of course, in our informed consents, and as well as in the explanatory knowledge, and as well as in when I would do the physical examination, we definitely try to explain this concept. And we try to explain to our patients that, look, don't be sad. You might be a square type, you might be a V type, but that doesn't mean you're not going to be good. The only thing that you have to know and understand that you have to be happy with your new version, with the illusion that we're going to create, and please don't go after the models that you're seeing on Instagram or on internet that you would make it as an idol and that you want to seeking to have that same body, because this might not be possible because of your bone frame. So please don't be disappointed, but please comprehend, understand the scientific fact behind it, and then upon this fact, we can change as much as we can in a way. Sometimes this might require 1 session, sometimes this might require 2 sessions, and some it might require 3 sessions of surgeries to achieve an acceptable result that makes us and you happy. So please try to comprehend this concept and believe in it. Thank you very much.